Hi, good evening. Thank you for being here on behalf of Brody Teenager. I am Brody's case manager. My name is Christina Cunningham. I started working with Brody earlier this year, and we saw him for some additional testing and treatment. So, a little background. Brody is a 15-year-old teenager who is being raised by a single mother. Brody only lives with his mom, and he doesn't have any contact with his father. Brody had some previous testing with his school, which kind of concluded that he was above average. He doesn't have any history of drug or alcohol use, and he tends to be reasonably well behaved at home. But he has some authority figure problems at school. He's become increasingly defiant and challenging at school, and his mother took him to his family doctor, who then referred him to us. Brody has some outward directed behavior, aggressions, noncompliance, overreacting, and impulsivity problems. His grades were starting to suffer, and he is slightly disorganized and has trouble keeping up with his assignments. Brody's very agitated when told what to do, and he tends to pick arguments with the teachers and staff. So what we did was we gathered a lot of information from Brody's teachers and his mom to determine what they noticed about his behavior. We were able to determine that some of his behavior problems were severe, especially when interacting with authority figures, but less with his peers. We could see other factors from assessments, and we didn't see any problems with bullying or a change at home or any mood disorders. We did find that he qualified for an ADHD diagnosis. We do not believe that his ODD symptoms have crossed into CD at this time, and we think that he will improve with intervention. So we treated Brody using some therapies and parent training to control some of his ODD and ADHD issues. We taught him some techniques for positive reinforcement. Brody has been participating in cognitive problem solving, skills training, and cognitive behavior therapy to help him respond positively to stressful situations. And he's also in intuitive to help him with his ADHD symptoms. He seems to be responding well to his treatments and therapy, and he is continuing to be seen by our office for cognitive behavior therapy and cognitive problem-solving training. He's also still taking his intuitive for ADHD symptoms, and he's doing much better at schools and not having as many altercations with the staff like he previously was. We're continuing to monitor his progress and regularly reassess to ensure that things are not progressing in a negative way again. Thanks for being here. If you have any questions, I'd be happy to hear them now, and we can go forth and see what else we can do for Brody. Thanks for having me.